and welcome to Graphic Online News in Brief. In the headlines, health experts in Ashanti region indicate a surge in COVID-19 cases in the region. Ghana Health Service allays public fears on Delta variant of COVID-19 in Ghana. Second prosecution witness in trial of alleged coup plotter says accused persons planned to destabilize Ghana. And abandoned theater project puts pressure on 25-year-old Kpone Polyclinic. News in Brief is brought to you by...
Download your Graphic News Plus now and choose your preferred package daily, weekly, monthly, and annually, and access free news on various interest areas as well. Graphic News Plus, connecting people through news.
And now the news in brief. Health experts in the Ashanti region say they are recording an increase in COVID-19 cases, particularly among the youth. They are therefore calling on Ghanaians to adhere to the COVID-19 safety protocols.
Dr. John Amoisi of the Kumasi Center for Collaborative Research, who disclosed this in an interview on Accra-based Joy FM, further warned that the country will be badly exposed if the deadly new Delta variant of the virus is detected in communities. He is, however, urging the Ghana Health Service to strictly enforce testing regimes and to quarantine persons who test positive.
If you look at the numbers in the Ashanti region, it's already going. We're doing some work, right, for which we need to do some pre-screening. And I can tell you that over the past 2 weeks, we've seen a significant rise in the numbers of positives that we're seeing. We did a pre-screening just yesterday, and half of those we pre-screened were positive. It's really interesting. And I actually told my team that just wait till next week. And it's exactly happening as I had predicted, because, the science doesn't lie. It's just like, it's just what it is. It will happen. All right, and it is happening. What this means is we need to be really careful. And if you watch carefully, it's exactly the same picture. It's the younger population. It's the younger population. I really support the call by Yao, the passionate call for us to go back to the basics. That will be our only saving grace.
The Ghana Health Service is allaying the fears of the public over reports that the new Delta variant of the COVID-19 virus has been detected in the country. According to the Health Service, the variant was detected only at the airport, explaining that all passengers who test positive for the coronavirus disease at the Kotoko International Airport are put under mandatory isolation.
The Director General of the Ghana Health Service, Dr. Patrick Kumar Boaje, who made this known in a statement, says Ghana has a robust surveillance system in place at the ports of entry and strictly isolates persons with positive cases. He refuted reports stating that the AstraZeneca and Sputnik V vaccines cannot fight the new variant and urges Ghanaians to take the vaccines when their turn is due while adhering to the COVID-19 safety protocols.
The second prosecution witness in the trial of 10 persons alleged to have planned to destabilize the country has told the trial court that the first accused person, Dr. Frederick Mapalm, is the main brain behind the alleged coup. He says Dr. Mapalm during a meeting was convincing some soldiers to execute the alleged coup to change Ghana's economic and social environment.
Major General Nicholas Peter Andor, who mounted a witness box on Tuesday, June 22, further told the court that his analysis indicated that Dr. Mapalm took practical steps such as manufacturing weapons that could cause harm and kill people to realize his plans. He added that the third accused person, Bright Alan Deborah Ofosu, at a meeting held at the next door beach resort in Accra, also tried to convince some soldiers to believe in the coup.
In our final story, the construction of a theater facility at the Kpone Polyclinic has stalled, forcing the hospital to refer patients in need of surgical services to the Tema General Hospital. Inadequate infrastructure at the clinic has resulted in overcrowding in wards, while others lie on beds on the corridors of the facility.
The theater was started in 2019 with funding from the Coastal Development Authority to improve healthcare delivery in the municipality and beyond. However, the senior medical officer in charge of the facility, Dr. Dorothea Ochre-Kilson, says that due to the absence of the theater, the clinic cannot offer antenatal services. She is therefore appealing to corporate bodies to contribute towards completing the theater block to improve access to better healthcare delivery.
Thank you for watching. We'll see you again tomorrow with another edition. Stay safe and protect yourself from COVID-19. For more news, visit graphic.com.gh or log on to Facebook at Daily Graphic and on YouTube at Graphic GH. I am Ama Amankwa Befi.
Subscribe now.